All right, welcome to our next talk. I'll just introduce myself because I'm the one doing it. My name's Shannon Shaffer. I am a nurse practitioner at the Cleveland Clinic specializing in movement disorders. I actually work mostly out in the region, so I work in Twinsburg, Medina, and Bath or Fair Lawn. So I was tasked once again with talking about what's new in medication therapy for Parkinson's, and luckily this year there is some exciting new things coming out. So I actually do get to talk about something brand new today, and so I'm excited about that. But I'm first going to kind of talk about the things, why the new medications are so important, and then I also want you to understand when this would be helpful for you. So on most of the slides, except for the brand new ones, I will tell you in what ways this type of medication can be beneficial. Do I have to advance it? I don't know. There we go. Okay, so as many of you may know or may not know, there are a ton of Parkinson's medications to choose from, and it can be very daunting to try to figure this out on your own. So all of the medications in red are some versions of levodopa, which is the medication that most Parkinson's patients will be on at some point in their lives. So it's the synthetic form of dopamine. All of these other medications kind of help the dopamine or help the levodopa work better in your body. So there's all different methods of delivery. There's all different ways that they support each other. But the interesting thing is the number of different forms we have of levodopa itself. So how do we choose? How do we know as a provider when you come and talk to us which one of these things would be beneficial for you? Well, the most important thing that I feel is the most beneficial for you is to have a movement disorders specialist. There are many in Cleveland. We've got many at the Cleveland Clinic. There's others at other hospitals. But knowing that this doctor was trained specifically in movement disorders, and that's all they do all day long, every day. So usually what they'll do is you'll have your initial patient consult with a movement disorder specialist, and they'll cover all of your medical history, when you first started having symptoms, how long you've been diagnosed, if you've tried any other medications in the past or not. This kind of prescribing with medications that there's so many choices is more of an art than a science. So there's not just one specific way that we can say, this is the medication, this is what you're going to take for the next 5 years, and then move on. It's an art. So it comes with what you're telling us that you're experiencing, and then we can provide to you the best tool to help manage those symptoms. You want to make sure that you trust your provider. You want a good relationship, and you want to feel like you can trust that they have your best interest in mind. I don't think that's a hard thing to find at the Cleveland Clinic. I tell my patients all the time I would send my parents to any of the doctors that I work with. But having that relationship and knowing that they're going to help your quality of life, and that's what the goal is. And then the other thing that's most important is understand why they think you need this medication or this adjustment to your regimen. And so making sure that they explain to you why they're choosing this can be really helpful so you can understand why you need to follow through with their recommendations. So the first thing I'm going to talk about is something that's going to be very soon not new, but I did include it because this is Rytary is how it's pronounced. It's the first true extended release version of carbidopa-levodopa, and it can reduce the number of your doses of medications by 1 or 2 doses throughout the day. There's various strengths that we, the provider, will use your current Sinemet dose to figure out what the equivalent would be to Rytary. And then we use different capsule strengths and different frequencies throughout the day to help manage your symptoms. So why would you need this medication? Sinemet might not be lasting dose to dose anymore, and you're taking a lot of doses, or the dose is very strong. You're unable to tolerate other drug classes. So on that first page, I had all those drugs listed that were not red. Any of those black medications that were up there could have different side effects, and you don't tolerate them. So if we've already got you on a lot of Sinemet, it's not lasting for you, we can't give you another medication because of a side effect, then Rytary is a great solution. And then also patients that start having a lot of peak dose dyskinesia and or wearing off together. So peak dose dyskinesia is when you have some extra movements when your meds are kicking in. So it's when that's the most Sinemet or the most levodopa you have from that dose. Once it hits the peak, that's when you start getting extra movements. You feel pretty good and you can walk around and move good, but you have these extra movements. So a lot of times we like the extended release Rytari because this doesn't peak as high in your bloodstream, and then you don't get those movements, but you still feel like you're on. However, hot off the presses, just last week, we had a new formulation similar to Rytari released. So this is something that's very exciting. We haven't had a lot of drugs released in the past few years. So Crexont is an even improved version of Rytari. So it is hopefully going to have less frequent dosing. It's an average of 3 times per day. Some patients that don't take a whole lot of levodopa, so less than 500 milligrams a day, will actually be able to try it twice a day, which is really great. So the thing that's different about this medication is that just kind of the chemistry of it inside. It's going to slowly release throughout the day, and it has a polymer in the substance or inside the capsule that allows the drug to stick to the insides of your small intestine, and that makes it last longer instead of just going through your GI tract and not lasting very long. I also put a little more of the info here. So there's granules and there's beads, and then there's this mucoadhesive polymer, and that kind of all together, it's really just levodopa, carbidopa-levodopa packaged incredibly smart so that it slowly is at different stages released into your body. Again, the reason that you would need this is very similar to Rytari, but you could also consider this if Rytari is still requiring frequent dosing for you. So the reason that is effective is, like I said, the same way, but it's going to be interesting as a provider to figure out who is going to be really great for Rytari, or how we're going to decide when you're ready to move on to Crexont, or are we going to start that first? Of course, that is going to be somewhat mandated by insurance companies and approval, but we will figure it out, and I think that it's a really exciting time to have a new medication available. So this will likely be available. It's already FDA approved, which is great, but it will likely not be available to be prescribed until maybe the end of September, while the Medicare and the insurance agencies are figuring out the payer information. This is just kind of how I talked about this already, but this is kind of how the two medications are the parts of the medication, what they look like. So the granules, they just have 100% of the carbidopa dose, 25% of the levodopa dose. That's within the granules. There's also beads inside the capsule, and then that shows how that breaks down. So 75% of your levodopa dose, there's no carbidopa in that. And then that on the very inner, the red, is the sustained release polymer, which makes it stick and stay longer. And then this is just from their study. The drug was called IPX203 when it was being studied, and it just shows you that in comparison, so the blue is what is now called Crexont, and the red is the normal immediate release carbidopa-levodopa, otherwise known as Sinemet, and it shows that on the first day, the scores, the motor scores, which are the scores that when you come into our office and see your neurologist, we look at, we have you do like the chicken dance thing. That's the score, and they're pretty similar at the beginning, but 2 weeks in, you can see that there's a lower score on the IPX203 or the Crexont, and what that means is that over time, your symptoms are improving to a significant level. So you're not getting quite as off, or you're not spending as much time off throughout the day. The next medication is Inbrija. So this one was approved in 2018, so not technically new, but it is newer. And I always think it's important because a lot of people don't realize that this one is even out there. So Inbrija is inhaled levodopa. This works very well for people that get morning akinesia, which means everybody always says, I can barely move in the morning till I get my first dose of pills. That's one reason to take it, and the other is if you have abrupt wearing off in between levodopa doses, and we don't really want to increase your levodopa frequency throughout the day. So you inhale this. It's just a powder that you inhale, and it can kick in as soon as 10 minutes after you inhale it. I will say that it's contraindicated in anybody that has lung disease or asthma and things like that. And there is a learning curve with how to use it. It's not like when you see people that take inhalers for breathing and they have to really puff it in. It's really, you have to be more gentle with how you breathe it in. But once you figure it out, it can be very beneficial, especially for those abrupt wearing off episodes. So Divi is another formulation of carbidopa-levodopa. It was approved in November of 2021. And what makes this special is that this is the first scorable Sinemet that we have that can go down to the 25 milligram components accurately. So Sinemet, everybody knows it's your yellow pill. There are a couple manufacturers that have a line down the middle. Most of them don't. So then when you're telling us that you can't take a full pill because it makes you nauseous or you're dyskinetic, then we say, well, break it in half. Well, it's not actually going to be exactly 50 milligrams, but it's the best we had at the time. So now Divi came out and there is 25 milligrams in each of those little sections on that pill. So you just break off one section if you just need a little bit of extra Sinemet. Or sometimes I'll prescribe to people, try 3 sections because that's 75 milligrams because you need a little more than half a tab, but a little less than a full tab. So this allows us to be more accurate with your dosing. And so here's more reasons of why you might need this. So dyskinesias are side effects on a half a tablet of Sinemet, which means maybe you only need a quarter of a tablet. And if anybody in here has ever tried to take a quarter of a tablet of regular Sinemet, it just turns into fairy dust. It's just, oh, never mind, there is no quarter tablet. So that's what's really great about this. And then we use this a lot of times after deep brain stimulation to help manage tremor and dyskinesias because those patients sometimes we're trying to work our way down off their medications, and this is a really nice way to do it. And then also sometimes small doses can be taken between doses when they're wearing off. It just depends on how your body responds to Sinemet and if that's a helpful thing. So we're super lucky because we have a special guest that's going to talk a little bit about his journey using Divi as an athlete. So we have Jimmy Choi here with us today, and he is an athlete on the national world level that has Parkinson's and is a Parkinson's advocate, and he's going to tell us about what it's like doing what he does and what medication helps him.
Thank you, everybody. My name is Jimmy Choi, and one of the things that Shannon said kind of just changed everything I'm going to say to you guys right now is that taking medication is an art. So for me, it really is like a lot of trial and error and trying to figure out exactly what your painting of your medication schedule is going to be like. Now, for me, I'm an athlete. For those of you who don't know, I've been on American Ninja Warrior 5 times since 2015. I have 3 Guinness World Records in fitness. And I've been a marathoner, an ultra marathoner, and all that good stuff. And I've done all of those things after I was diagnosed with Parkinson's. Thank you. I was diagnosed at the age of 27, and I am now 49 years old, so I've been living with this disease for more than 21 years. Everything didn't start out like I am now. In fact, I was walking with a cane 8 years in, and then later on in life, I figured out the first thing that was going to help me, which is exercise. And then the second thing was going to help me was my medication. How do I make my medication more efficient for me and the things that I need to do? Okay. Now, one of the things that I've been able to do over my years is that I started tracking how I was feeling with medication, what I was eating, and the activity that I was doing during the time of my medication. And I would track this for months. And ultimately, I gave all that data to my movement disorder specialist. And we figured out that I have these on and off periods, these peaks and valleys. And my goal has always been to try to flatten those peaks and valleys be as flat as I can. So I wanted to bring that control into what I was able to do and using medication to bring that control down so that I can flatten those peaks and valleys. Now, last January, I was fortunate enough to compete for a world record in Italy. Now, when I was out there, I was on the Guinness World Television show, and we had to do this live. But with television, you never know when you're going to compete. You never know when you're going to actually do the things that they want you to do, much like in life. We go through life every day. You never know when some emergency situation is going to happen or when someone's going to change your schedule. So I brought a video to show you guys today, and I want you guys, in this video, I walk through my entire day of breaking that world record, okay? And you'll get to see what that world record is. It is a push-up world record. And that during my entire day journey and how my schedule kept changing from what they're telling me and how I had to keep shifting my optimum movement zone throughout the day so that I can still be able to compete when I needed to, even though it wasn't when they told me it was going to happen. Okay, so Ryan, if you please, we show this video.
The last full dose of medication that I took was about 6:30 a.m. this morning, and I'm in beautiful Milan, Italy, for this world record challenge. Right now it's about 9:05 a.m. I've let myself come to a near off state right now for my medication. I'm going to keep myself at a dose where I can move and operate until a little bit later. Then I will go and put myself into a higher dose, right into a dopamine surplus. If you look at the medication, every one of these big white pills packs the same amount of medication as one of those little yellow ones. But I can break these white pills into half or quarters so that I can give myself half doses. So for the rest of this morning, up until about 11 a.m., I'm going to give myself half doses every 45 minutes to an hour until I need to get myself ready and put myself into that dopamine surplus. Right at about 12 o'clock, I'm going to get myself into a surplus and then let myself come back down. And then hopefully at 1 p.m., between the time of 1 p.m. And 2 p.m., I will be at my best levels for me to perform, to try to attempt another world record. So roughly 2 hours and a half away from our world record attempt. By the way, guys, I want you to meet Alex.
How you doing, guys? How we doing?
Alex broke my push-up world record a while back. Instead of going head to head with him, we're actually going to work together on a tandem push-up, high five push-up record. Right now, we're about 2.5 hours away from when we need to be attempting the record. So I'm going to be taking additional medication now to put myself into a dopamine surplus. It is a way for me to make sure that I am above my dopamine needs at this time, and then I'm gonna let my system work through so that hopefully, if I timed everything right, when we are attempting the record, I will be at the maximum controllable dosage of synthetic dopamine. Remember, we talked about these yellow pills having the same dosage as these white pills, but the advantage is that I can split these white pills in half for half doses or quarter doses with precise measurements. So I'm going to be taking a full dose of the yellow and a half, so getting myself into a little bit more extra than what I normally take.
Yeah.
So right now I'm in dopamine surplus, so all this movement is uncontrollable. So I'm going to start to come down into the high levels of dopamine where I need to perform. And then once that happens, I'm going to go into a maintenance dose, which is a quarter pill every 30 minutes until we finish our record attempt. And then after that, I go right back into my normal dosage. So wish me luck.
All right, we're back in our green room, and I am at a good dose right now, coming off of the dyskinesia and the dopamine surplus. So I'm actually quite stable. And unfortunately, we found out that the production time has been pushed back. So now I have to bring myself back closer towards the off state and then restart. So we'll see how it goes.
All right, so now we got an update on our production time. It seems like instead of 3 o'clock time now, we've been pushed up
just a little bit. So instead of coming all the way down in an off state and then coming right back up into a surplus, I'm going to go into a little bit of a surplus right now by adding a half pill. And then I'm going to go ahead and hopefully that brings me right back down right in time for the warm-ups. And then I will maintain with a quarter pill every 30 minutes until I am done with the record attempt. So hopefully, you know, these things happen in life. Timing changes. So we're just going to have to make adjustments and adapt to the situation. All right, it's 2:20 right now. We're right back into the dopamine surplus. Hopefully in about 5 to 6 minutes, I should be coming right back down into my optimal range. All right. So right before going on, the timing was a little bit right in the borderline. I did take a quarter pill. I'm gonna be in a little bit of a dopamine surplus during the interview section, but hopefully once we're ready to go, I'll be nice and level. So this is it. We're getting ready to get on. As you can see, I'm wearing a bunch of stuff.
3, 2, 1, go. Come on, come on. Questa sera ne hanno eseguiti correttamente 50 e con questo conquista lo spirito.
Hold it out. Here we go.
Now, in case you guys didn't get it, the final number was 50. It was 50 clapping push-ups right from the ground. But as you guys can see, now I know not everybody out here is out there breaking world records and things like that. But as you can see how just everyday life can change and your schedules and timing can change with everything, especially if you have kids, you have grandkids, your life is on their schedule, not on yours. But I want to thank you guys for allowing me to share that with you. But I think having a real life experience, letting you guys see how a person can use medication and use that as their advantage throughout the day. I think that could be beneficial for everybody and give you guys all the best chance to move the best that you can throughout the day so that you can live your best life. Thank you.
All right, so I just have a couple things that I want to finish with. I restarted my timer, so hopefully this goes well. All right, so a couple other drugs before we wrap this up. Ongentys is a medication that was approved in 2020. This can be added to your levodopa that you already take, and it can help block the breakdown of the levodopa in the blood. So it keeps more of your medication available in your body for longer. This is the same drug class as entacapone, which is an older medication that many of you might be on already. And instead of having to take it with every dose, you can take this one once a day. So as you know, you probably get very sick of taking all of your pills. If you can reduce any pill burden any way you can, and plus this is a very good replacement, it probably might work even a little bit better for you than the entacapone did. So again, these are more down here. Why would I need this? If your medications, they work really good when you're on, but they just don't last from dose to dose. You're already close to a side effect limit, but you're still having some wearing off, so you can't really go to a full next dose. You can add in one of these medications because they kind of just bump up the strength of your levodopa and extend it a little bit. And then also if you don't want to add more levodopa, but you still need a little more on time, and you don't want, like I said, the big pill burden, multiple extra pills to your regimen. Norion's was approved in 2019. So I know that these are not that brand new, but these are newer drugs that many of you might not be on and you might not be prescribed, and it's good to be able to ask your provider about them. So this works on a different brain pathway to impact the effectiveness of the levodopa. And the big thing is it's supposed to not increase dyskinesias. Some patients it can still, but that's one of the things that if we're worried about, we have off time and we have troublesome dyskinesias, you can add this medication, which can help with the on time and hopefully not increase the dyskinesias. As you see there, though, most common side effects, dyskinesias, hallucination, and dizziness. So those are things that it's similar to if you have too much levodopa, because this is just helping increase the effectiveness of the levodopa. So I kind of already mentioned why you would need it, but you were to reduce your off periods without increasing your levodopa dose. May help increase your on time without excessive, daytime sleepiness. I didn't mention that. Excessive daytime sleepiness, if you get that from your pills, that may, you might not be as susceptible to that if you add Norion's instead of increasing levodopa. And then increase on time with less dyskinesia. So, the other things that I wanted to talk about are things that are around the bend. So in the very near future, we are going to be able to treat your Parkinson's disease with something called subcutaneous levodopa. Right now, what we have out on the market that is similar to this is something that has to be placed with a PEG tube that goes into through your stomach, and it ends in your small intestine, and we can use a pump that you wear externally to deliver levodopa directly to your small intestine. That works because that's what we've had for many years, but this is the new version of the pump that we are eagerly awaiting FDA approval for right now, and it can help keep you in a more steady state of levodopa for 24 hours a day. So this is just kind of a chart showing what happens as Parkinson's disease advances. And if you see the wide white area on the left side of this graph, this is how much good time you can have with your levodopa when you're first diagnosed. So you've got a good amount of time where you feel pretty good, and that's what we call your therapeutic window. As your disease changes over time, you see that white, it gets to a more narrow therapeutic window. That's right, I think I have. Oh no. I have a thing. So as we go through time here, our window gets really little. When our dose is too high, we get dyskinesia. When our dose is too low, we get off. So the goal for these pumps has been to keep you going right through here as your disease changes over time. This is what the pump looks like. So it's not tiny, but it's also smaller than the pump we have available right now. They say that it's about the size of 2 iPhones stacked together. And then the tubing doesn't have to be surgically placed. As you can see up there in the top corner, it's something that just goes right under the skin. This is very similar to how insulin pumps work for diabetics. And then the other thing, if anybody saw Dr. Anis's discussion about research, there are some genetic therapies that are being studied right now. And so genetic therapies are one of the big exciting things for the future, because we do know that a small percentage, 10%, 5 to 10% of Parkinson's disease can be linked to genetics. And so with the gene therapies, we don't have any that are FDA approved right now, but we're close. We have trials going on, and this is something that if you want to learn more about, we have our research table outside that they can talk to you about that. And then also anything medication kind of related, anything related to any of these talks are also, we have more pamphlets and information outside the door. So if you have any questions about stuff that I've talked about. So that's it. That's what I have for the new medication therapies. I think we had an awesome interjection there with Jimmy Choi. And if you guys have any questions for me, or even Jimmy, we'll just be down here after the fact. And then the next thing will be the next exercise session next door. And that's going to be Rock It Out, Rock Steady Boxing. And I highly suggest that you guys experience that if you never have. Thank you.